Takao is a genius doctor working in the diagnostic department of a hospital, solving unknown medical mysteries and murders that the police are unable to solve. The episode begins with a young woman named Takao who works as a doctor in a hospital. She is seen typing articles on her computer about her profession. The scene then shifts to Tenikai General Hospital, where a very ill child is brought in with his mother. She tells the doctors that her child has been vomiting several times. His vision is blurry. He's been crying from headaches, and his body has been aching for weeks. She adds that all the clinics they visited could not determine the cause. Dr. Takao asks her to calm down as they await the test results. The doctor, Takao, sits in front of the machine to review the child's test results. Nurse Mai informs him that the child's condition has stabilized thanks to NTM medics and suppositories, but he still suffers from severe dizziness, nausea, headaches, fatigue, and limb pain. Takao responds that such symptoms should have been easily diagnosed by the other clinics. Based on the symptoms, he suggests the possibility of a rare neurological disorder or a congenital genetic defect. When the test results arrive, they show no elevation in creatine kinase or signs of abnormalisis, so the results are completely normal. Yet the child still complains of kidney pain. She has seen transitions to another patient complaining of severe stomach pain. Dr. Takao examines him and asks if he has eaten anything unusual recently. The patient denies it. The team requested to wait a bit longer while they run tests. The abdominal examination shows no signs of food poisoning or appendicitis, so they decide to do a CT scan to investigate further. Mia takes the opportunity to ask Takao why he is working in the emergency department despite being a member of the investigative pathology department. He replies that he is a temporary assistant allowed by his supervisor due to the overwhelming workload in the emergency department, which urgently needed extra help. At that moment, Dr. Takao enters. Mia introduces herself as a first-year resident, Mia Kanawiki, and expresses her dream of working with Dr. Takao. Dr. Takao informs the doctor, Takao, that 2 patients' cases remain undiagnosed. He expresses his desire to take responsibility for their diagnosis. Takao understands that he wants to focus on diagnosing and agrees to leave the rest to him. She examines the test results and goes to check on the child. Upon arriving, she notices a bag with vitamin A supplements among the mother's belongings. She examines the child and determines that he has vitamin and toxicity in the accumulation of excess vitamin A. His body causes symptoms such as pain, lip and skin disorders, dangerously high intracranial pressure, headaches and nausea, fatigue, and limb pain. Takanashi asks how the child reached the stage, but Takao doesn't respond directly. Instead, she tells the mother that her child has reduced vision. The mother admits to giving her son large amounts of blueberry snacks and vitamin A supplements, believing they would improve his eyesight. Dr. Takao explains that exceeding recommended doses of vitamins caused this issue and that giving excessive amounts will not improve eyesight. She instructs the mother to stop giving her son vitamin A immediately. Next, Dr. Takao examines the second patient, who has multiple symptoms. She asks him if he recently ate fish he caught, such as sardines. He confirms that he did. Takao diagnose him with a parasitic infection and requests that canister call the gastroenterology department for an endoscopy to remove the parasite. She deduces this based on several clues. The patient's darkened face suggests he spends much time outdoors wearing a hat. His agent can make it unlikely he does strenuous outdoor work, and he has a small wound on his left index finger, so likely from removing a fish jig. The patient's abdominal pain began when the parasite entered his stomach and attached to its wall. Amazed by Dr. Takao's reasoning while they talk, Takashi receives a call from emergency services regarding a man injured at a construction site near Lake Kurumi Park. The man fell and has a severely injured lower left leg. Currently receiving CPR en route, Takanashi instructs his team to prepare saline and blood transfusion equipment for when the patient arrives. They perform first aid. Upon examining the man's leg, Kanashi suspects he was bitten by an animal. He asks the nurses to stop until the police arrive. Suddenly, a syringe containing blue liquid falls, and the paramedic informs Kanashi that the patient's blood is blue. This shocks everyone. At that moment, Dr. Takao arrives to assess the situation, followed by the police, who begin investigating whether the incident was an accident or something else. Afterward, Takao invites her friends Maya and Takanashi to her home to search for any news about a large predatory animal, such as a lion or crocodile, to figure out what happened to the injured man. Takanashi asks her to leave the matter to the police, but she responds that it's her duty to uncover the truth about the man as well. Takanashi insists they stay out of it, pointing out how strange the case is. The man's blood was blue, and his leg was bitten off by something massive in the middle of Tokyo. Takao declares that she won't drop the case for precisely this reason. Her curiosity about it is too strong. At that moment, Takao receives a call from her supervisor and leaves to see what he needs. When she meets him, the supervisor orders her to stay away from the incident and not interfere with the police's work. Takao explains that she's investigating a polarizing case as part of her work in the investigative pathology department. That the supervisor reports that her department focuses on diagnosing diseases that other departments fail to identify, not investigating dead patients. Takao interrupts, asserting that it is a doctor's duty to uncover what happened to a patient and reveal the truth. The supervisor dismisses her argument, instructs her to focus on diagnosing living patients, and ends the conversation. Furious with her supervisor, Takao resolves to continue her investigation. Takata Chashi takes her outside, and they head to the incident site. There, they encounter several police officers investigating the case. Takao asked them for information about the man with blue blood, but they didn't know anything about it. She counters, insisting that she knows they are aware of the case, pointing out that a member of the 1st Division of the Metropolitan Police has been seen accompanying Miru from Tanashi Police. She further claims that the man with blue blood is part of a murder case. One of the officers tells her they cannot disclose any information about their investigation to outsiders. Takao proposes the deal. She will provide them with valuable information if they follow her. She leads them to Kurumi Lake Park, pointing out the museum ahead. She explains that the museum has a large tropical fish tank and a small planetarium in it, which has been under renovation for 3 months, and it's set to reopen tomorrow. Takao then takes them to the construction site behind the forest near the museum where the body was found. She asked the officers why the victim's leg was severed. They admit they haven't received autopsy results yet, but suspect a wild dog or two roaming the massive park could be responsible. Takao counters point out that the wound indicates a fang size much larger than 5 centimeters, making it impossible for a dog to sever a human leg. The officers realize that Takao implies she knows what kind of animal caused the injury. So indeed, Takao does know. She leads them to a massive creature resembling a dinosaur, Tyrannosaurus rex. However, she reminds them with a wry smile that Tyrannosaurus rex has been extinct for 66 million years. Our episode begins in this place where Sakurai is speaking with Takao and Takanashi. He says according to the forensic team, a positive luminal reaction was observed on the teeth of the skeletal remains. The wound on the victim's leg also matches the dental structure. It is safe to conclude that the Tyrannosaurus rex bit off the victim's leg. Takao responds, I deduced that from the phenomenon itself and my own observations. Judging by the wound, I determined that a very large creature bit off his leg, but there aren't many such enormous creatures in our era. The sea is far away from us. To be bitten by something like a shark, in other words, it must have been done by something not present on land today, and yet I felt that this museum was nearby. Sakurai replies, as expected of you. Sakurai's friend interjects, are you suggesting that the skeleton moved on its own and bit off the victim's leg? But why was your patient's blood blue? She replies, now it's your turn to share some information. Clearly you've forgotten to tell me more about that skeleton. What did it look like on Friday? He responds it had been almost fully assembled. Work had to stop because of rain in the afternoon, but was completed later in the evening. I recognized him. He was 23 years old and had served time in prison for assault. After his release, some people discovered that he entered a building belonging to a known gang. The first person to find his body was Manabe, a 50-year-old supervisor at the construction site. Work had stopped due to rain, but he became concerned. While inspecting the site, he found Kennedy. A doctor from a nearby private clinic, Hechichuka Clinic, was called to examine the victim by Manabe, Takanashi adds. The victim's leg was severed, and there was nothing the doctor could do. Takao then visits Hakashuka Clinic, but finds no one there. A man emerges who turns out to be Dr. Hachisuka. Takao introduces herself as the director of the pathology department at Tenikai General. She asks, why didn't you treat that man here? "You have an operating room," he replies. The lower half of his leg was severed, and his heart had already stopped. The clinic was closed that day, and I had no nurses. Just having an operating room doesn't mean I can treat everyone afterward, Takao tells Sakurai. I'll request your crime lab to take a closer look around the museum tomorrow morning. If my hunch is correct, concrete evidence about the culprit was left at that museum, Sakurai says. I want you to tell us what you're doing, she retorts. I don't have to justify myself to people stingy with information. There's another, larger case hidden behind this one. She then asked Katori, did you notice any suspicious men around the crime scene earlier? Katori replies, you mean those guys who look like Yakuza? She says, don't you remember what happened yesterday? The 4th Division is a forgotten name for the organized crime unit. Another incident occurred in this area. Katori tries to recall and says a shooting in Narima. That's right, she replies, a serious incident that could harm innocent civilians. So last night, after identifying the body, they learned that the only person they were targeting was the victim. The problem is the person who shot him was the accused member. The police believe the Yakuza killed Komari in retaliation, so that's why they conducted a swift investigation at the headquarters. If this case isn't solved quickly, it could lead to an all-out war between two factions. Sakurai says, that's what I expected of you. It's possible the Yakuza member who shot Komari is dead. No, she replies. His wounds are severe, but not fatal. He's the deputy leader of a small Yakuza gang currently in conflict with the Komari gang. After being shot, Komari fled but was eventually captured, tortured, and killed. That's what we believe for now, Tequila tells them. I have a theory, but I'm not certain enough to share it yet. I'll investigate further to refine my suspicions. They arrive at the museum, where Takao discovers the blue blood, which belonged to the victim. She concludes this blood is the biggest clue in this mystery and will lead us to the answer. In the storage room, they notice blue blood on the floor. Sakurai's friend asks if Komari can kill here. So they proceed to the room where Takao is shocked to see the dinosaur. She thinks deeply and finally says, allow me to give you my diagnosis. So after that, we see this man running quickly, arriving at the room and astonishing everyone, to which Kyle says to them, we need to carefully consider every event to solve this case. The corpse with blue blood, the severed limb by a Tyrannosaurus Rex, the gunfire in Narima, and the blue stain in the storage room. The full picture starts to form when these events are connected. First of all, we need to focus on why the victim's blood is blue, although the phenomenon itself isn't that strange, Katori explains. The condition where patients' blood turns blue is known as methemoglobinemia. It's a disorder where hemoglobin in red blood cells oxidizes or turns blue, impairing the natural oxygen transportation process. Symptoms include difficulty breathing, loss of consciousness, and, in severe cases, death, Takao adds. This occurred due to me, the maglobinemia within the short hours between the shooting and his death. After you shot the man from the rival gang, he fled after being hit by a bullet, Katori explains. Methemoglobinemia usually appears as a symptom of poisoning, but it can sometimes be caused by drugs such as procaine. Komari displayed symptoms of methemoglobinemia after being administered a local anesthetic and died from oxygen deprivation, Takao notes. Komari didn't suffer a normal injury. The bullet wound remained in his body. Chitachisuka's clinic treats those involved in organized crime. During the operation, a large amount of local anesthetic nihilists have been used. As a result, Komari developed the model of anemia and entered a critical state. However, fearing exposure as a crime, Dr. Hachishioka didn't transfer Komari to a fully equipped hospital, so he went to the museum for treatment because it contained drugs capable of treating him. Takao continues at the museum. This man tried to save Kamada using methylene blue, which has a strong reducing effect and can treat the meganemia when taken orally or intravenously. Methylene blue is also used to treat diseases like white spot disease and water-molded fish. Since the museum housed many fish, they had methylene blue. Komari urgently needed treatment, so Hachisuko dragged him into the storage room and tried to make him drink the methylene blue. However, Komari had already died. The leg was severed by the bullet to hide the evidence. Hachisuka couldn't use standard tools for this and wanted to make it impossible for anyone to know someone had attempted treatment. He resorted to cutting the leg with force, using something heavy and sharp like a dinosaur's teeth. He then transported the body through the forest behind the museum and dumped it at the construction site. Not expecting anyone to find it so quickly, Takao concludes while applying chest compressions to Kameidi's dead body and calling emergency services. The rain washed away the evidence. That's the hidden truth behind this case. But seriously, using Rex to cut off a leg and perform chest compressions, he could have committed the perfect crime if it weren't for a genius like me. At the hospital where the victim was taken, no one knew everything about this. Hachisuki yells, "Do you have any proof?" Takao responds, "Did you forget what you said at your clinic when you mentioned the museum? You were so scared because everything here has your fingerprints. You've succumbed to my deception." Tachisuko retorts, "Even if there are fingerprints, you can't prove I cut off the man's leg and dumped the body. That's not enough to arrest. Trust me," Takao replies. "You won't just be arrested for tampering with and disposing of the body. You'll also be arrested for breaking into the museum with the intent to steal. Of course, your clinic will be searched, and they may find Komeda's fingerprints and blood there for some reason." Realizing he's cornered, Hachisuka collapses to the ground. Sakurai thanks Dr. Takao for her help. Chichisuka tries to attack Emiko, but Katori intervenes, tackles him, and punches him. Emiko yells at Katori, calling him a child. "I appreciate you viewing my anime recap, Unruly Family. Please let me know what you think about this anime recap by liking, sharing, and commenting, and please subscribe to the channel to help us reach 5,000 subscribers.
Take you out.